Good afternoon. So we'll complete the topics of neurology today. Okay, we'll be doing two short topics. One is myasthenia gravis, and another one is motor neuron disease. So we'll start with myasthenia gravis. Okay, so this is a neurological disorder. So what is it? It is an acquired autoimmune disorder characterized by fatigable and fluctuating muscle weakness. So what is it? It is muscle weakness. So that is the first thing you have to remember, that it is a disease of muscles, right? It is a disease of the muscle. The muscle is becoming weak. And what is the cause of that weakness? It is caused by an autoimmune disorder phenomenon. So the pathophysiology is autoimmune. And what type of muscle weakness? It is characterized by two features, and these two features I have already highlighted. It is fatigable and it is fluctuating. So this whole definition we will discuss in detail in today's class. The disease is myasthenia gravis. It is an acquired autoimmune disorder which is characterized by fatigable and fluctuating muscle weakness. So it's a muscle weakness which is fatigable and fluctuating, caused by one process which is called as autoimmune disorder. So we'll discuss in detail about these factors. So what is the pathophysiology of this muscle disorder? The disease is not in the muscle. The weakness is in the muscle, but the disease is not in the muscle. The disease is in a certain position of the nervous system that is called neuromuscular junction. So the disease is not, the muscle is not getting diseased. The muscle is becoming weak, but the process of the disease is located in a particular place in the nervous system, and that place is the neuromuscular junction. The name is very suggestive. It is a junction. Junction means what? Junction means a meeting point, right? We have a railway junction where two stations is a meeting point between two stations. So a neuromuscular junction is also a meeting point between the neuro and muscle, between the nerve and the muscle. Okay, the muscles you know is a bulk muscles, and the nerve you know is a electric wire type structure. So the junction or the meeting point between the nerve and the muscle is called neuromuscular junction. And the disease we are discussing, myasthenia gravis, is because of some dysfunction or disease in this particular place in the nervous system. The disease is in the junction of the nerve and the muscle. At that point, there is some disease occurring. What is the disease that is occurring in that point between the nerve and the muscle? The disease is the loss of some receptors. Microscopic receptors. Receptors are what? Receptors are bodies on the cells which receive some transmitters or neurotransmitters. Okay, so somewhere in the neuromuscular junction, there are some receptors which is lost, which is destroyed. And that receptor is responsible for receiving this neurotransmitter or chemical in the body called acetylcholine. We already discussed while doing epilepsy that there are various neurotransmitters in the nervous system. We talked about two neurotransmitters there. We will talk about a third neurotransmitter, that is acetylcholine. Acetylcholine is a neurotransmitter which helps in muscle contraction. And this neurotransmitter or acetylcholine will fix to that receptor or acetylcholine receptor to help in muscle contraction. But what happens when this acetylcholine receptor is destroyed or lost? Then this neurotransmitter cannot attach to them, and therefore it cannot cause muscle contraction. So loss of this receptor leads to ineffective muscle contraction, and that is the cause of this muscle weakness. The muscle is okay, is normal, but still it is becoming weak. Why is it becoming weak? Because of disease in the neuromuscular junction, the point where the nerve attaches to the muscle. At that point, there is loss of certain receptors called acetylcholine receptors. These acetylcholine receptors receive, a receptor is receiving. The receptors receive sound, they are the sound receptors. Receptors receiving light are the light receptors. Receptors receiving acetylcholine is an acetylcholine receptor. So when this receptor is lost, then they cannot receive this neurotransmitter called acetylcholine, which helps in muscle contraction. And therefore, muscle contraction is not going to be effective. So this is the pathophysiology of myasthenia gravis. Because there is loss of acetylcholine receptors, which is supposed to receive this neurotransmitter acetylcholine to cause muscle contraction. If it cannot receive it, that means muscle contraction is not going to be effective. And therefore, it leads to ineffective muscle contraction. And if the muscles don't contract, therefore, the person cannot walk, the person cannot do the activities of daily living, because the muscle has to contract for movement. Otherwise, there will be no movement. So that is the reason the muscles become weak, and muscle movement is affected in myasthenia gravis. I'll come to this again. So, we said the acetylcholine receptors are lost or destroyed. How they are destroyed? They are destroyed by the phenomenon of autoimmunity or autoimmune mechanism. Autoimmune mechanism, again, highlighting the word auto and immune. Auto means self. Immune is an immune reaction. So, the body is developing a mechanism where it is destroying some of its own structures. Usually, immunity occurs to some external danger in the body. When someone has a bacterial infection, then immune mechanism will start working against that bacteria. When someone has a viral infection, immune mechanism will work against that external virus. So that is because of external threat to the body. But unfortunately, what is happening? The immunity is developing towards some internal structure in the body that is called autoimmunity. We do not know why this is occurring, but it may be because of some abnormality in the thymus gland. Thymus gland is there in the body. There is some abnormality. Thymus is a immunological gland. Because of some abnormality in this immunological gland, the body is fighting against its own structures. That is called autoimmunity. Usually, inflammation and immunity occurs against external threats to the body, like bacterial, viral, fungal, any type of infections. The body tries to form antibodies against those infections. But in this case, the body is forming antibody against its own structure inside the body, and therefore it is called autoimmunity. The body is forming antibodies against what? Against the acetylcholine receptors in the neuromuscular junction, which are destroyed, which are its own products. Therefore, it is called autoimmunity. And what triggers this? It is not some infection or some external threat. It is because of some abnormality in the body's own thymus gland that is causing the problem, because thymus is an immunological structure in the body, right? So the thymus gland can sometimes enlarge, it can have a tumor, and this causes an autoimmune reaction inside the body, and this autoimmunity destroys and produces antibodies against its own structures like the acetylcholine receptor, which gets destroyed. And because of this, the muscle contraction cannot take place. And therefore, it is called an autoimmune disease or autoimmune mechanism, where the body is becoming immune and developing antibodies towards some of its own structures. Therefore, it is called autoimmune. Thymus gland is there in the chest cavity. There's some small gland. It usually becomes atrophic in old age, and it is an immunological gland, but sometimes it has abnormalities. And these abnormalities trigger that autoimmune reaction against the receptors of acetylcholine. And therefore, that causes the muscle weakness. What are the clinical features of this disease? We said it causes muscle weakness. But what type of muscle weakness? We said it is fluctuating muscle weakness. Fluctuating means up and down, changes are there. Our mood fluctuates. Sometimes we are happy, sometimes we are sad. Again we are happy, again we are sad. So it fluctuates, it changes. So here the muscle weakness is also changing. In what way is it changing? Sometimes the person is weak, sometimes the person is normal. So it is a fluctuating weakness. Usually the pattern of weakness is the person is normal in the morning after getting up from sleep, and towards the evening and late in the night, the person becomes weak. So what type of weakness is there? There is weakness in the eye muscles, the ocular weakness, ocular muscles. And that leads to ptosis. Ptosis means the drooping of the eyelids. It leads to diplopia or double vision. There is weakness in the muscles of chewing, that is the bulbar muscles. The patient cannot chew things like meat. They can chew rice because rice is soft, but meat is very tough. They have to chew for a long time, therefore they have difficulty in chewing meat. Facial muscle weakness, they have difficulty in moving the facial muscles while smiling. Limb weakness, they have difficulty in lifting the upper limbs or hands. They have difficulty in standing from the sitting position. During the initial part, I have said that the weakness is not only fluctuating, but it is fatigable. By fatigable, it means that the weakness improves after rest and the weakness increases after exercise. So the person is all right in the morning after getting up from sleep because the whole night the person has slept and it is totally restful. So in the morning, the person can open his eyes, can eat, can walk, and can lift the hands. But after exercise, after working for a few hours during the midday, the person is a little tired and then the problem starts. The eyelids will start drooping. The person during lunch will not be able to have meat because they cannot chew. The person cannot lift the hands. They cannot stand. And again, if the person goes off to sleep and takes 1 or 2 hours rest, the person is going to become normal. So it is having fatigability and it is fluctuating. It changes its behavior. This is a picture of ptosis, where the person cannot open the eyelids. The eyes are covered, are partially opened and partially covered. Ptosis means inability to completely open the eyelids. So this happens not in the morning but towards midday because it is fluctuating. This is the person cannot smile properly because of weakness of the facial muscles. The full smile cannot be given because the facial muscles are weak. But the weakness is again fluctuating. It is going to be all right in the morning and after rest, and after some time when the person uses it, it is going to become more and more weak. Again after rest, it is going to improve. So this is the characteristic of myasthenia gravis. What is the management? We know that the problem is the acetylcholine receptors are lost. But we don't have so much of technology as to go and put a new acetylcholine receptor in the neuromuscular junction. That is technologically not possible. So what do? We give acetylcholine extra into the body, right? So acetylcholine medications which increase acetylcholine is given. So the quantity of acetylcholine is increased in the body and the muscle starts working or contracting properly. Because it is an autoimmune mechanism, we have to suppress or decrease the immunity, and therefore we give immunosuppressant drugs like steroids. The problem is because of some disorder in the thymus gland, which is an immunological gland. So we investigate the thymus gland by CT scan and biopsy, and if possible, thymectomy or removal of the thymus gland is done if any abnormality is detected, so that this disorder and the triggering is not present. Right? I will go over it again before we move to the next topic. So the disease we are discussing is myasthenia gravis. What it is an acquired autoimmune disease. By this time you know it is autoimmune disease, characterized by fatigable and fluctuating muscle weakness. So now you will realize and you appreciate what is fatigable and what is fluctuating muscle weakness. Fatigable means increases after exercise and improves after rest. And fluctuating means it changes during the course of the day, sometimes more, sometimes less. Autoimmune means it is an immune reaction producing antibodies against the own body itself. So myasthenia gravis is an acquired autoimmune disorder characterized by fatigable and fluctuating muscle weakness. It is a disease of the neuromuscular junction, that is the place in the nervous system where a nerve meets and connects to a muscle. The nerve is connecting to a muscle. Why? To make the muscle move so that we can walk, we can talk, we can lift our hands, we can run. So at that place where the nerve is signaling the muscle and is contacting, there is the disease. And what disease is there? What structure is involved? The acetylcholine receptors are involved and they are lost and destroyed. Because the acetylcholine receptors are destroyed, they cannot receive the acetylcholine neurotransmitter, which is a neurotransmitter helping in muscle contraction. And because they cannot receive this acetylcholine neurotransmitter, which helps in muscle contraction, there will be less or ineffective muscle contraction. And this ineffective muscle contraction causes the weakness of the muscles. Okay? And we already said that that structure in the neuromuscular junction called acetylcholine receptor is destroyed by an autoimmune mechanism which causes autoantibodies and destroy the receptor. This autoimmune mechanism is not triggered by something outside from the environment, but it is triggered by its own gland inside the human body, that is the thymus gland. The thymus gland has some abnormalities like thymic tumor or thymus enlargement, and this is causing the triggering of autoantibodies against the acetylcholine receptors. And that gets destroyed to produce the illness. So because of this muscle weakness, it produces a typical type of picture which is very easy to recognize because it is fluctuating. Fluctuating means during the course of the day, the type of weakness and the symptoms change. In the morning after rest, the patient is okay. As the days goes by, when the person starts doing their daily job and daily work, the weakness starts. Again, after rest in the afternoon, if the patient takes an afternoon nap, again it is okay. When they get up in the evening, after some time, again the problem starts. So what type of weakness is there? There is weakness of the eye muscles, the ocular weakness, because of which the person cannot close the eyelids properly. And that is known as ptosis, inability to fully close the eyelids. Ptosis. They cannot move the eyeballs properly, so there will be diplopia or double vision. They cannot chew the food properly because of bulbar weakness. They cannot chew meat properly because meat is tough and they have to keep chewing for it to be for them to be able to swallow it. So meat chewing becomes difficult. Facial muscle weakness, the patient finds it difficult to smile. They have limb weakness, upper limb and lower limb, so they cannot lift the hands properly to keep the things, or they cannot stand from sitting position. And it is important to note that this weakness is improved after rest. That means if the person rests for some time, goes to sleep, takes a nap, does not work for a few hours, then they become okay. But after exercise or after doing some work, the weakness increases again. So the features are very typical. The person will come and say that when I get up in the morning, I'm totally okay. But by midday, I cannot close my eyes, my eyelid starts drooping. I cannot chew the meat I eat for lunch, but in my breakfast, I was able to eat meat nicely. But because of the chewing difficulty, I cannot eat meat in the lunch, but breakfast, I was able to eat nicely. And in the afternoon, I'm not able to chew meat properly. Then they will be able to say, in the morning, I was able to smile properly, but afterwards, I find it difficult to smile. So this weakness is very fluctuating. And they say that if I take an afternoon nap, I'm all right again. In the evening, I'm fine. But afterwards, again, it starts. So it is a fluctuating weakness and it is a fatigable weakness. That means improves after rest and increases after any type of exercise. So this is a picture where the patient cannot open the eyelids properly. That is called as ptosis. Ptosis is the eyelids come down. They cannot open it properly, right? They cannot open the eyelids properly, so the eye is half covered and half exposed. They cannot smile properly because of facial weakness. And it keeps changing. In the morning, the person is going to be totally all right. In the evening or afternoon, they'll have these problems. And if they take a rest, again, it's going to be okay. How do we treat these patients? We know the fault is in the thymus gland. So the thymus is going to be looked and investigated by CT scan of the thorax and the thymus to see if there is any abnormality. And accordingly, the thymic operation or removal, that is called as thymectomy, can be done by the vascular chest surgeons. Then, because it is an autoimmune process, we have to give immunosuppressant drugs to decrease the immunity in the form of steroids. And because the acetylcholine receptors are not working, but we cannot replace the receptors in the body because we don't have that technology, we have to give medications that will increase the neurotransmitter acetylcholine in the body so that they help in muscle contraction. So this is about the disease called Myasthenia gravis, and it is a neuromuscular junction disease. It is an autoimmune disease. It is characterized by muscle weakness with two important features, that is fluctuation and fatigability. And it is because of some disease of the thymus gland, not thyroid. We have to make distinction. Thyroid is different, thymus is different. Thyroid gland is an endocrine gland. Thymus gland is an immunological gland, right? So not thyroid. Please make Please understand the difference. Thymus gland, not thyroid gland. Thymus gland is having the problem, and thymectomy can be a part of the treatment, not thyroidectomy, thymectomy. Both are different glands. Okay? So this was about myasthenia gravis. So I will proceed to another topic, but if any questions on this topic, please let me know.
Yes, sir.
Okay.
Yes, sir.
Any confusion, any topic regarding myasthenia gravis? The patient will give you a very good history, telling that in the morning I'm okay, then afterwards I have the problem. What problem do you have? I cannot open my eyelids, I cannot chew meat, I cannot lift my hands, and then after if I take some rest, I'm again able to open my eyelids, I'm able to chew, and I can work. But again it starts off. So fluctuating and fatigable, very important. If you recognize these symptoms, then you can diagnose myasthenia gravis. And you can locate it as autoimmune disorder of the neuromuscular junction because of destruction of the acetylcholine receptors which are there because of some abnormality of the thymus causing an autoimmune reaction. You can treat by thymectomy, giving extra acetylcholine so that the symptoms improve, and immunosuppressant drugs like steroids. Okay, then I'll go over to the next topic, that is motor neuron disease. Okay, motor neuron disease is a neurological disorder, and the location of the disease is different. Like we said, for myasthenia gravis, the location of the disease is in the neuromuscular junction, the place where the nerve meets the muscle. Here, the disease is in the motor neuron. Okay, so we will discuss in detail about this disease, that is motor neuron disease, or in short from MND. So what is the definition? MND is a heterogeneous group of disorders which leads to, number one, progressive weakness of muscles of the bulbar, that is the muscles of swallowing, limb muscles, upper limb and lower limb, thoracic muscles, muscles of the chest, abdominal muscles with normal sensory bowel bladder function. So what is the difference in myasthenia gravis? Myasthenia gravis is fluctuating. It is there, it is not there. But motor neuron disease is progressive. It is there 24 hours, and it is going to progress. It is going to worsen day by day, month by month, year by year. The disease is going to progress. So that is the difference. Myasthenia gravis was fluctuating up and down, up and down. But it is increasing. In most motor neuron disease, the weakness will increase day by day, month by month, year by year. It is a progressive disease which will not come down. What is the cause of this disease? It can be inherited or it can be sporadic. It is a disease of the motor neuron in the brain and the spine. It is a disease of the motor nerve cells in the brain and the spine. There are many types of nerve cells called neurons. It can be motor, it can be sensory, it can be special sensory, it can be autonomic. But this disease affects only the motor. Motor means associated with movement. Sensory means associated with sense. That is the heat, cold, vibration, pain, all these are sense. And motor means movement. Autonomic means uncontrolled activities like the heart rate, the bowels, the erection, ejaculations, all those functions are autonomic. But here it is only going to affect the motor parts of the brain, the motor neurons of the brain and the spinal cord, not the sensory, not the autonomic. But the unfortunate part is that the cause of the death of motor neuron is not well known. Like in other diseases, we know what is causing the disease, whether it is autoimmune, whether it is infective, whether it is vascular. But in motor neuron disease, in spite of so much research, we do not exactly know what is the cause of death of this motor neurons in the brain and spinal cord. Okay, so therefore it is still under high research to know what is the cause, because still now we do not know what is the cause of the death of those motor neurons in the brain and spinal cord. The clinical feature is it starts gradually, slowly it starts. It is progressive weakness, difficulty in talking, difficulty in swallowing. It is increasing day by day, and it has no means of stopping. It is progressive, it progresses, it worsens. Very important feature is there is something called muscle fasciculations in this disease. Fasciculation means what? Fasciculation means the involuntary movement of the muscles. The muscle flickers. The muscle moves involuntarily for a few seconds, for a few minutes, and then stops again. It is not a very violent movement like a seizure or epilepsy. In epilepsy also we have involuntary movement, but it is a violent movement which shakes the whole body. But in fasciculation, the movement is very, very slight. A small part of the muscle is going to flicker and move, and then after a few seconds it's going to stop. Only the person who is having can see it, and sometimes can show it to the doctor that it is moving for some time and then it stops. Okay, very small movement of the muscles involuntary, that is called fasciculation. But the other part is normal, normal sensation. The person will have normal heat, cold, pain, no problem in that. The patient is going to be conscious oriented. The problem is with the muscle weakness. And the biggest problem is that it is progressive. It is going to increase, it is not going to decrease. There will be wasting of the muscles. Wasting means loss of bulk. The muscles are going to become smaller. The muscles are going to become atrophied. They are going to become smaller. They are going to lose the normal contours of the muscle. So wasting is loss of girth of the muscle. The muscles are going to become smaller in case of motor neuron disease. Here we can see in these two pictures how the muscles of the hand have become smaller. Normally this thinner eminence, hypothinner eminence is the bulk. You can see your own hands, these are swollen. Okay, these are swollen. But in the case of motor neuron disease, the muscle is atrophied. They have become thinned out. They are loss of the muscle mass, thin muscles. Even in the dorsum of the hand, there is loss. The muscle is becoming thin. The tendons are visible. And this is because of loss of muscle mass, and that is called wasting of the muscle. Here you can see the tongue. The tongue also has become wasted. Okay? The tongue muscle has thinned out. There are grooves seen in the tongue because the muscles are not healthy. The muscle is wasted. So this is motor neuron disease. We do not know what is the cause of motor neuron disease, and because of that there is no definite treatment in motor neuron disease, because we do not know what is causing the death of the cells in motor neuron disease. We only can offer them physiotherapy exercise and speech therapy for the muscles of the mouth, tongue. So I will go over motor neuron disease shortly again. As the name suggests, it is a disease of the motor neuron. So what are motor neurons? Neurons are cells. And motor neurons are motor cells. Sensory neurons are sensory cells. So here, the disease is only in the motor neurons that control the movement of the body. It is a heterogeneous disorder, group of disorders. Many classifications are there, but together it is called as motor neuron disease, which is characterized by the progressive weakness or increasing weakness of bulbar. Bulbar means the tongue muscles, the muscles in the mouth, the limb muscles, that is the upper limb and lower limb, the thoracic muscle, that is the chest muscle, the abdominal muscles, with normal sensory and bowel bladder function. Sensation is going to be normal. Only the weakness and the muscle power is going to decrease. It can be inherited, it can be a genetic disorder, it can be sporadic, that is environmental, or the disease of the motor neurons in the brain and spine is there. We do not know the cause of this disease, what causes the death or destruction of these motor neurons in the brain and spine. It is characterized by a gradual onset. It is starting slowly. It has progressive weakness. That means the weakness will keep on increasing because there is no treatment. And the difficulty in talking, difficulty in swallowing is going to be there, and it is going to keep on increasing because unfortunately we do not have any treatment. There will be wasting or atrophy or thinning of the muscles. The muscles are going to become thin in the whole body. And the muscle fasciculation, very important. The person is going to tell that I have small involuntary movement in the muscles, like flickering of the muscles, which I can see sometimes, but it is not very violent. It is small involuntary movement of the muscle. That is called as fasciculations. Otherwise, the other things, sensation and consciousness, is going to be normal. So, wasting is very important. Fasciculations, these muscles will show small movement involuntary, that is called fasciculations, and the disorder, as we said, is progressive. Tongue wasting is seen, and therefore, because the pathophysiology is not known, we do not know the cause, therefore we cannot pinpoint any definite treatment for these patients. So physiotherapy, speech therapy are the only two things we can do for these patients, but ultimately they have a very poor prognosis because of absence of proper treatment, and they will require support of ventilator also in the end and Riles tube because they cannot swallow, they cannot breathe because the muscles of the chest become very weak, right? So it's a very progressive type of disease, and very unfortunately, no treatment is available for motor neuron disease till date. So any questions that you have on this? Motor neuron disease? Any queries? You must have seen in the ICU also we have patients who are on ventilator because of motor neuron disease for a long time because nothing definite cure is available. And they become weak day by day, year by year, and it progresses. Any questions? Any queries?
What is mortality for motor neuron disease?
Mortality is there. It is mostly 100% will have mortality in these patients because we have no treatment. Whoever has motor neuron disease confirmed by all means, we cannot offer them any definite treatment, supportive treatment as long as the patient is there, but otherwise mortality is 100% in this. We can only give supportive treatment like Riles tube, ventilatory support, nutrition, but otherwise still date no definite treatment is there for motor neuron disease. Very unfortunate disease because it has a high mortality then.
Sir.
Yeah.
I have seen using Rilutor and the medication like Alprax and Rilutor. So are those medications given for specific?
Yeah, we have Riluzole to give for motor neuron disease, but again, it is not a 100% treatment. It just decreases or slows the dependency on a ventilator. Suppose the person is given early in the course, it will delay the dependency on ventilator because ultimately the patient after 1 year or 2 years will require support from ventilator because the chest muscles will become so big that they cannot breathe anymore. So it does not cure the disease, it delays the dependency on ventilator, but Riluzole will not cure motor neuron disease. No definite cure is there, although many research has been done with stem cell transplant and other things, but we do not have any guidelines or approved therapy for cure of motor neuron disease. So I think we have completed most of the topics of neurology. You can discuss with your seniors regarding anything is left or not, because from our side we have completed most of the topics, I think all which is required. If anything more is there, then you can inform to the department and we will plan the other lectures accordingly. But from our side we have completed whatever has to be done. So please discuss with your tutors, with your teachers, what other topics, if anything is left. They can communicate to us, we will be there in the OPD, over phone also be available. And accordingly we can plan the other lectures, okay? Because most of the topics have been done, with starting with encephalitis, headache, seizures, then movement disorders, peripheral neuropathies, stroke, and then we had motor neuron disease, we had Myasthenia gravis. So I think most of the topics that is associated with neurological throughout the neuro axis has been completed, but if anything else is there in your syllabus, you can inform, and accordingly next week we can plan. Otherwise from our side we have completed, so please inform accordingly. Any more questions? Any doubts to be clarified from this topic, or any question from previous topics that you're remembering which needs to be clarified?
No, sir.
No, not so okay. Then we will end today, and if anything is there, you will let us know accordingly. Okay, thank you.